Hello. Could you tell me your name, please?
Yeah, Mr. Johnson. I have seen you once before, but it was long ago. Uh,
Oh, no, I'm sorry. I think I made a mistake. Tell me, what's brought you here today, Mr. Johnson?
Doctor, I have had this heart attack 2 weeks ago, and I was admitted in the CCU, I think, and then I was discharged 4 days ago.
Okay.
I'm very tired, and I don't have much energy. I feel weak, and I'm really terrified to do anything. I'm not sure if I get the heart attack again because, I can't do any swimming or any gardening or anything. I'm really afraid that this
Okay.
might come back again.
Okay.
So
Yeah.
I was wondering what I should do, and how much physical activity is okay for me.
Okay, I'm totally understand your concern. I know how terrifying experience it could be for you, and I know that you are worried about your work, your routine activities. But let me show you that it's totally normal that you feel like this. You've got a heart attack, and it's kind of a full pressure on your body, and now your body needs time to recover itself, and it means that it takes time for you to return to your routine activities. So just give time to your body to recover itself. It's totally normal. Okay, is it
Uh, y-
okay?
yes, sure, doctor. When can I go back to work, actually?
As a normal after a heart attack, it takes a time. It takes some time to return to your normal activities. For instance, if you'd like to resume your work, it may take around 4 or 6 weeks, but it depends on your body. It can differ from a person to person. It depends on how your body recovers itself. But generally, it takes around 4 to 6 weeks. But after 2 weeks, you can do some less vigorous activities. I'd like you to to go a walk gently, have a gentle walk. It will be very good for your body as well. And yeah,
Right.
is it
Okay.
okay with you?
What can I do to reduce the risk of any further attacks in the future?
Mhm. That's a good question. I'm really glad that you asked this question. Given the fact that you've got a heart attack, so you need to do something, you need to consider something to reduce the risk of any further attacks. So, first of all, I'd like you to have a healthy diet. Um, Try to opt for high energy and less fat food. In this way, you can reduce your cholesterol level as well. Another things that I like to suggest is that try to have regular exercise to maintain your weight in a healthy range, and also your body will be refreshed and will be able to keep itself healthy to prevent from any other attack. Do you have any questions so far?
No, actually, I don't have any questions yet. That was very helpful. Thank you.
That's good. And another thing that I'd like to mention is that there is a rehabilitation program, and I'd like you to contact this program. It will be very beneficial. In this way, actually, you exercise your heart muscles. and make it more make it stronger to deal with other events in the future. If you'd like, I can contact them on your behalf and arrange an appointment. Is it okay?
Yes,
What do you
sure.
think about
Yeah,
it?
that's great.
That's
Thank you.
good. So I will do
Thank you.
it. Okay.
Right.
Is there any other concern you'd like me to address?
No, thank you. Thank you.
That's
Okay.
good. Thank
Right.
you. See you
Bye-bye.
later.
Bye. Okay, we don't need to say any. Is there any other concern, or just is there anything else you would like to ask me? Okay,
Okay.
is there anything else? Right. Okay. Let's. That was good. Let's see if how you reflect on this. Okay.
Okay.
How do you feel?
در مورد همین چیزی
Yep.
که
For,
okay.
for just what you did, do you feel satisfied, not satisfied, happy, unhappy? Do you think you could do better? You could do. Do you think you did great?
No, I could do better. I
Okay,
think I
so
could do better.
but are you okay? Are you feeling satisfied or
So, I think.
so? Okay, so what sort of? I mean, from 0 to 10, what score would you give yourself?
5.
A 5 out of 10.
Yeah.
Okay. So, what did you do well?
Information giving, I think that was the things that I did better.
Okay. And what else? Did you connect with the patient? Did you have a good connection? A good rapport?
I think I did.
Okay. So, information gathering?
No. I
Uh,
think I was awful.
no. Okay. So how about, did you have a good structure? I mean, the patient comes in, they're worried about something, and you make a diagnosis, and then you give them some information about that concern.
Because you said that I know this patient, how I couldn't understand I understand it from the case note, from the role play. At first, I thought that it's a new patient after recovery, because I tried to start with a greeting and asking about his name, or introduce myself. But because you say that I know the patient, then kind of I lost the communication, and actually the patient started to give the information and what happened before.
Okay. Okay, good. Okay, so information gathering. Did you gather information?
No.
No. Okay, information gathering could be done better, and structure. I didn't get it. Were you happy with the structure or not? Yes and no.
So yes.
Okay. Yes and no. Okay, for the
Yes.
structure. Okay. Right. How about information giving? You said it was good. Exploring eyes, ideas, concerns, expectations. Did you explore that?
Because the patient at first said everything, and then I think no, I didn't do this step. No.
You did it partially, okay? So
Yeah.
you did some exploring eyes, but you could have done that better. Okay. Exploration. No. Okay. So, uh, was there anything else you think you could do differently?
Information gathering
Okay.
and and drop off.
Okay.
I
Uh,
think actually I didn't get the patient involved in the in the interview. Yeah.
okay. Okay. No, and I would say probably some chunking and checking. Okay. Now, then we will discuss that. Okay. Now, let's say what you did. The patient comes in. They say they're worried about having another heart attack. Okay. Okay. What information can you gather?
Just about the heart attack and when was that and how is he feeling at the moment and what is his concern.
Okay.
Actually, he was concerned about returning back to the work.
Okay. So he's worried about physical activity. So that is his concern. Okay. So the concern is physical activity. So what is the idea which is related to this concern? There is an idea which, okay, which leads to this concern. What is that? That physical activity causes a heart
He
attack.
felt tired because he felt tired and he was
Uh,
concerned that he couldn't able he
feeling
will not be
weak.
able, yeah, he will not be able
Uh,
to work.
so basically, physical activity causes a heart attack. Okay. So the concern, I cannot do physical exercise. I cannot exercise. Okay. Or function. Right. So what is he expecting now?
He expect me to do something about his ability and actually increasing his physical strength.
Okay. Yeah, but I said, what can I do and when can I go back to work? Okay.
Yeah.
Uh, what can I do and when can I go back to work? Okay. Right. What can I do? So, do we need more information here?
Uh, yeah, I think I should ask how do you feel now and what do you do at the moment? I think. What about? I should ask about our current lifestyle.
Mhm.
I think I should start in this way. First of all, I'd like to ask you a bit question about your current condition,
Good.
and then we will chat about the rest, and have a, for instance, have a suggestion for you
Okay.
returning back to the work. I think I should start the communication in this way.
Good. Okay. So in this, the information gathering and ice exploration, as you mentioned, so to explore how much, so you need to find out how much physical activity uh, and how much he can tolerate. Okay. He has and he can tolerate. Okay. And then we address the idea, which is okay, physical activity doesn't mean that you will have a heart attack. It's too much physical activity, which is too much for your heart, will cause that. Okay. Okay. Now, about your work, can I go back to work? Uh, what do you do for a living? Well, I work in an office. Well, there's no
Yeah.
physical strain. Or if the patient says, um, um, I don't know, I'm a heavy lifter, or I don't know, that couldn't be okay. So it depends on the type of work. So we can actually check. Okay, that
Yeah.
is what I mean by exploring eyes. And work here is a cue. Okay, we call it a cue.
Yeah.
Uh, or the patient said, I'm terrified. Okay, it's a cue. What is terrified? It means very concerned. So we need to pick up the cues. Okay, these are the verbal cues. Um, and then yes, we have to explore the cues. So if whenever you have the cue, and he says, "Well, when can I go back to work?" Okay, yeah, work. You said, "Are you anxious? Are you trying to go back to work as soon as possible? Are you afraid of going back to work? Um, and what do you do for a living?" Okay, so you can ask further questions. And the patient says, "I'm terrified." Oh, sorry to hear that. Why are you terrified? Well, because I think I might have another heart attack. Okay. Um, and then chunking and checking. Okay, something I noted was that you continuously spoke. Okay. It's without any interruption, and that is not something we want. You mentioned in your second speaking, in your second test, you kept speaking, but that's not something that is expected. What you need to do is to show these communication skills, and it means that you need to interact with the patient. And this is a common mistake. A lot of people actually think that the more they speak, the better. But no, that's not the case. Uh, they look at your engagement and how you interact with the patient, and for that you get some marks. And you need to show these skills. Even if you have the skills and you don't demonstrate, you don't get any marks for it. Okay. So basically, we don't want to lecture. Basically, it's not a lecture type. It's actually interactive. It's like a workshop. Okay, like question and answer. So I always give that, make this example. I say, um, uh, a lecture, you continuously talk, and in the end, you say, okay, are there any questions? But in an interactive question and answer or workshop, you say something and get feedback and then do the next bit. So that is chunking and checking in information giving. Okay. But overall, I think it was good, but I think um, you have a better understanding now why what we're going to do. Okay. Looking at the task, your question was, what should I do with this in the 3 minutes I'm given? Okay. What do you do in the 3 minutes? Okay. Well, um, you plan. Okay. Uh, right. This task. No. First of all, the setting is general practice, so you know the patient. Okay. If it's a hospital, you need to introduce yourself. If it's not, it's general practice, you know the patient. You say whatever you want to say. You say, oh, Mr. Johnson, or Mr. whatever. So you just say the name. Or you can ask, well, is that Mr. Johnson here? And, is that Mr. Smith? And they say, yes, it is. Or maybe they say, no, my name is this. Okay. So usually you're supposed to know them. Okay. And you don't need to introduce yourself.
Okay.
So now task.
So in all the role play that it's in general practice, I know the patient and I shouldn't give information about myself. Yeah.
Yeah. So you can even at the beginning say, I mean, before you start, you say, okay, I know the patient. What is the patient's name? Okay. It's general practice. This is general practice. Do I know the patient? And they say yes or no. Okay. But usually
Okay.
you're supposed to know the patient, so you don't have to introduce yourself.
Okay.
Some people say, okay, we want to be proactive. We always introduce ourselves and ask the patient's name, and we say that we are a locum practitioner. Well, I don't think it's a good idea because you're supposed to be in general practice. It doesn't say, bless you.
Thank you.
Uh, it doesn't say you're a locum. So, okay. So planning ahead. Now, find out, okay, advise, explain, reassure, provide. Okay. Basically, these are the recommendations, that the task. Okay. It's a guidance. It says that you need to do these. Okay. Now, just going back to the um, here. Okay. So basically, it tells you find out what is worrying. Okay. Find out where does it go in our structure. Find
Uh,
out.
Exploring ice, I
Yep,
think. Yeah.
information gathering to explore ice. Okay, so find out. It means obviously. So where does it come at the beginning of the consultation? Okay,
Yeah.
and be reassuring. Okay, some fatigue is to be expected. It usually takes some weeks before full energy levels return.
Okay.
Okay, advise. Uh, okay, where does it come?
Expectation. Yeah.
Uh, okay, so basically, you have found out uh, basically here the structure. The patient comes, they want something, you gather information, and then you make a decision. You say that, well, the decision is that there's no danger, there's no risk. Reassure, okay, and then give the patient what they need.
Need.
Okay, so basically, you can say, well, you can attend cardiac rehab. And this is good because then you don't have to worry about how much exercise you can do. There's somebody to look at you. Okay. Because, well, because it's under supervision, then you don't have to worry. And then explain that exercise is important. Also, these reassure the patient that the concerns are appropriate. Well, but moderate physical activity is all right. 2 weeks after a mild event with good recovery. Okay, so it is 2 weeks since their admission. Basically, you can say you can have moderate physical activity. Okay, so reassure them and provide recommendations to prevent attacks in future. Okay, so these all come in the which part? All of these come in the advice and reassurance. Okay, um, but what you need to do here is chunk and check. Okay, so you basically you explain. You say, okay, um, you can attend a cardiac rehab program. Is that okay? Right, okay. And this is because in this program, there is always supervision. So you don't have to worry how much you exercise. Is that
Exercise.
all right? Yes, that's all right. Okay. And then little by little you can increase your physical activity, and it is totally safe and it is recommended. Is that okay? Yes, that's okay. Okay. So you chunk and check. You don't have to explain continuously. Actually, you should chunk, and you should, and in this way, you actually have time to think as well. Okay, and it's more communicative. Okay. Uh, so, um, right. So, you mentioned what we do in the first 3 minutes. So, in the first 3 minutes, you plan ahead. Uh, how do we do that? We say, okay, how I say I connect with the patient, say hello, how are you? Uh, okay, and then find out what the problem is. Okay, find the agenda. Uh, okay, now if it is or if it is not in the task, it doesn't matter. Okay, even if it doesn't say find out what is worrying the patient, it doesn't matter. You have to ask it. Okay,
Okay.
find the agenda. So this is what you write. If it says in the task here, the patient says this, um, and be reassuring. Some fatigue is to be expected. So the patient's problem in fatigue. Find the agenda, make a decision, and respond to agenda. Okay, so that's basically that's how we plan. We say, okay, what part of this task? This part is asking questions. So you can have a picture. Okay, there's a 45-year-old man who's had MI. 2 weeks post MI is coming here with a problem, and then I need to be reassuring. So I need to find out what it is, and then give these pieces of information chunk by chunk. If the order is okay, that's fine. I do it one by one. But if the order is not logical, I can change that. And I don't have to do all of them. Cardiac rehab program is a good one. Exercise is a good one. Um, Moderate physical activity, and 4 to 6 weeks return to work, and prevention of future attack. Okay, so these are the important points you can use. You don't have to use all of them. Okay, uh, do you want me to play it for you?
Yeah.
Okay, you the patient, I'm the doctor. Is that okay?
Okay.
Would you like that?
Yeah.
Okay. Uh, right. Okay. Uh, right. Okay. Hello, Mr. Johnson. How are you today?
Well, doctor, actually, I had a heart attack 2 weeks ago, and
Oh,
yeah, now I feel a bit tired. I couldn't do my daily job, daily activities, and
mm,
I'm kind of worried about my work. I
right.
think
Okay.
I couldn't come back. I came back to work because I'm really terrified about another heart attack in the
Oh dear.
recent
Mm.
future. Yeah.
Yeah, yeah, I understand. Yeah, I know it's can be horrible. I'm sorry to hear that, really. Right, but you're better now, aren't you? And so what is the problem now? Um,
Um, Yeah, now I'm really feel fatigue, and actually I'm concerned about my future. I think that I couldn't do my jobs, and I couldn't deal with this
Right.
situation anymore.
Okay. What do you do for a living, if I may ask?
Um, yeah, I'm a teacher.
You're a teacher. Okay.
Yeah.
Okay. So basically, you don't have much physical activity in your job. It's just that, but you're worried about that, obviously. Okay. So basically, so you mentioned you went to hospital 2 weeks ago, came back 4 days ago. So it's 2 weeks after your heart attack.
Yeah.
Um, and you're worried about your future and what would happen. What exactly are you worried about? Is there anything in particular you're worried about?
Oh, well, I think activity and physical activity is the things that makes my heart
Right.
condition much
Okay.
worse. And
Right.
yeah.
Okay, yeah, physical activity, of course, when the heart needs more oxygen, it can actually have problems. But that is why, physical activity is recommended, and moderate physical activity is a good thing after the heart attack. Yeah, is that all
Well,
right? Yeah,
yeah, but I don't know how much exercise, how much
right.
activity I can do.
I
I
see.
know I'm scared that I overdo activity.
All right, okay. Well, that is why, there's a cardiac rehabilitation program for this reason, because most of the patients are like you, they're confused. They don't know how much activity is allowed. That's why
Hmm.
you can go to this rehabilitation center, and under supervision, you can do exercise, and there are people around you to look after you and to make sure there is not extensive or too much physical activity. So it is very safe and it is constructive. It makes you feel better. So that's a good idea. Also, yeah, and after that, you can little by little go back to your normal life after 4 to 6 weeks, usually. So, yeah, so what else? Is there anything else you would like to know?
Doctor, when can I return to my work? When I
Right. Good
restart it?
question. Good question. You probably would look forward to it. Yes, after 4 to 6 weeks, you can get back to your normal work, and especially because you don't have any physical job, and your job is not too demanding physically, then you can go back to work in 4 to 6 weeks' time. Yes. Is that all
And
right? Yes.
yeah, and how can I prevent from other heart attack? I'm kind of terrified about any future events.
Good question. Everybody asks that. Obviously, what we're trying to do is to prevent high cholesterol, high weight, and to make sure that your blood vessels remain open and you don't get any narrowing in your blood vessels. So basically, yes, keep on exercising, reduce your weight and fatty food, and have a healthier lifestyle, basically. And that's it. And yeah, continue with your medicines. Is that all right?
Yeah, thank you. Thank
Okay.
you, doctor.
Right. See you later.
Thank you, too.
Okay. So what did I do differently?
You got information gathering at first and ask about my concern, and then step by step try to address my concerns and ask the
Okay.
question.
Okay. So when the concern changes, I explore it, and then you say work. Then I
Yeah,
ask, okay, what do you do for a living?
what do you
Then
do?
you say physical activity. Yes, you're worried about physical activity, so you go to a rehab center. Then the next question comes, when can I go back to work? And then I explain that. How can I prevent from future attacks? And okay, so that is more interactive. I'm trying not to be lecturing, but to be
Yeah.
asking questions and answers. Okay.